Recent studies have shown that certain frozen foods can significantly increase blood glucose levels in people with diabetes due to their high content of added sugars and simple carbohydrates. This scientific fact is crucial, as about 30% of people with type 2 diabetes struggle to keep their glucose levels under control due to poor dietary choices. In this video, we will delve into the 7 worst frozen food options for diabetics, explaining how these foods can affect your health and offering practical tips for making better dietary decisions daily. Number 1. Dishes with a high content of refined carbohydrates. These are mainly found in products like white bread, pastas, and non-whole grains, and are also common in many frozen meals. These carbohydrates are quickly absorbed into the bloodstream, causing spikes in glucose levels. For example, a study published in the American Journal of Clinical Nutrition found that diets high in refined carbohydrates can increase the risk of insulin resistance and type 2 diabetes. Prefer frozen dishes that contain complex carbohydrates like quinoa, bulgur, or barley. If you choose to prepare your frozen meals at home, use whole ingredients like brown rice and whole wheat pasta, and enrich your dishes with legumes, which are not only low on the glycemic index, but are also high in fiber. Number 2, sodium-rich meals. Frozen meals often contain high amounts of sodium as a preservative to extend their shelf life. High sodium intake is associated with an increase in blood pressure, which is particularly dangerous for people with diabetes who already have a higher risk of cardiovascular disease. Look for frozen options containing less than 300 milligrams of sodium per serving, or consider preparing and freezing your own meals using herbs and spices to add flavor without the need for extra salt. Some recommended herbs include oregano, rosemary, and thyme. Number 3, options high in saturated fats. These are common in frozen dishes like pizzas, pasta dishes with creamy sauces, and fast foods that include processed meats. These fats can contribute to the buildup of plaque in the arteries, increasing the risk of cardiovascular disease, a common complication in people with diabetes. Select frozen meals that are made with healthier fats, such as monounsaturated and polyunsaturated fats found in olive oil, nuts, and fish. If you decide to prepare meals for freezing, use cooking methods that require less fat, such as baking, roasting, or steaming. Number 4, meals with added sugars. Often frozen meals include added sugars, even in products that are not typically sweet, like prepared meals and salad dressings. Excessive consumption of added sugars can trigger rapid increases in blood sugar and, over time, contribute to insulin resistance. Read nutritional labels to identify and avoid products with added sugars. Names like high fructose corn syrup, dextrose, and sucrose indicate the presence of added sugars. When preparing your own meals, opt to use natural sweeteners in small amounts, such as stevia, which has a minimal effect on blood sugar. Number 5, dishes with additives and preservatives. These are common in frozen meals to maintain freshness and enhance flavor and appearance. However, some of these chemicals can have adverse effects on health, such as altering metabolism and problems in managing blood glucose levels. For example, studies have shown that certain additives like monosodium glutamate can exacerbate obesity and affect insulin regulation, complications frequently seen in people with diabetes. Opt for frozen meals with short ingredient lists and free of artificial additives. When preparing meals to freeze at home, use fresh and natural ingredients and preserve your dishes using natural techniques like quick freezing or using natural acids like lemon or vinegar that do not negatively affect metabolism. Number 6, meals low in fiber. Fiber is essential for a healthy diet, especially for diabetics, as it helps regulate blood glucose levels and promotes satiety, reducing calorie intake. Many frozen meals lack adequate fiber, which can lead to spikes in blood glucose and poorer appetite control. Check the fiber content on the labels of frozen meals, choosing those with at least 5 grams of fiber per serving. Alternatively, you can add your own fiber sources to frozen meals, such as adding a side of steamed broccoli, spinach, or a small salad. When preparing meals for freezing, include a good amount of vegetables, legumes, and whole grains. Number 7, unbalanced frozen alternatives. A balanced meal should include an adequate proportion of macronutrients, proteins, carbohydrates, and fats. Many frozen meals do not meet this criterion, which can lead to nutritional imbalance, especially affecting people with conditions like diabetes, where the balance of macronutrients is crucial for disease management. Look for frozen meals that offer a balance of macronutrients with special attention to proteins and healthy fats. Labels should show a good balance between these macronutrients, avoiding excess simple carbohydrates and saturated fats. For homemade preparations, plan your dishes with a healthy proportion of vegetables, rich in fiber, lean proteins such as chicken breast, fish or legumes, and healthy fats like olive oil or avocado. Another aspect to consider is choosing the right cooking oils, especially if you have diabetes. In this video, we reveal the cooking oils you should avoid for better blood sugar control, discover which oils may be harming your glucose levels, and which are the best alternatives to maintain your health in optimal condition.